That possible major shakeup for healthcare in the Triangle. WakeMed could block Cigna Insurance starting January 1st. Negotiations between the hospital system and the insurance giant still underway.
Elena Athens live now at WakeMed here in Raleigh. And what are you hearing from patients tonight, Elena?
Yeah, well, a WakeMed spokesperson says primary care physicians will remain in network for Cigna patients because that is a separate contract. So that is good news for folks who do have that insurance provider. However, everything else could change in the new year. Cigna customers who now use WakeMed's hospitals, specialists, or urgent cares could soon be forced to pay out-of-pocket prices at the start of 2024. The healthcare system sending out warnings that the change could happen if a new agreement isn't reached with the insurance provider.
I sort of feel now that, I'm a little bit of a pawn.
Michael Mall says the change would be brutal for Wake County residents. He mostly uses WakeMed and worries in an emergency situation he would have to drive further away to stay in network or pay deeply out of pocket to continue going to his current doctors.
But if I wanted to use WakeMed, I, wouldn't be able to. And, that would probably more than double the health care costs.
I requested information from both companies how many Cigna customers use WakeMed. Neither company is providing that number. Cigna says in a statement, our goal is to keep healthcare affordable for our clients and customers, especially as they are managing rising prices due to inflation. WakeMed says it's working to come to agreeable terms and asking for reimbursements that is fair and equitable as compared to the market and what they, meaning Cigna, are paying other hospitals for the same care. WakeMed went on to say that negotiations are about much more than finances, also the unfair burden on patients. Unified Women's Healthcare is one medical group trying to ease fears, especially for those who are expecting and set to have their babies in the new year. Unified Women's Healthcare is recommending that patients do not cancel future appointments, and the center is planning to formally request a continuance of care through delivery. The two have until December 31st to strike a deal. We're live in Raleigh. Elena Athens, ABC 11 Eyewitness News.